letter. This is from my company. Okay, let's see what it is. This letter is to inform you that you have been terminated from this company. Oh my god. I cannot accept this. I work really hard in this company. Why I have been fired? I need to call my girlfriend. Tell this bad news. Maybe she can help me find a new job. Hello? It's me. I have a bad news to tell you. But you also want to tell me bad news? Okay, you go first. No. Why? Why you want to break up with me? You cannot accept this. Oh my god. I'm really sad. Hello? I have nothing to do with my life. I've been fired. And my girlfriend left me. I think this is the right decision for me. I don't want to live anymore.
Now we know that Saiful has dual diagnosis. Dual diagnosis, or also known as co-occurring disorder, can be defined as a condition when a person has both mental illness and substance use disorder simultaneously. It is either the condition of repeated use of substance will lead to mental illness, or the condition of having mental illness will lead to substance use disorder. The person with dual diagnosis can be presented with substance use disorder first, and the mental illness will develop after that, or vice versa. The substances that can cause the disorder are psychoactive compounds with the abilities to cause addiction, which are nicotine, alcohols, cannabinoids, opioids, depressants, stimulants, and hallucinogens. Meanwhile, the example of mental illnesses are schizophrenia, schizotypal, delusional disorders, bipolar affective episodes, and severe depressive episodes. Usually, people with dual diagnosis are unable to maintain employment, keep in functional relationship, have legal problems, financial issues and extreme mood swing, and unable to control their emotions. Hence, they should get treated to help them improve in life. But there are some significant issues in treating dual diagnosis patients. Next, my friend will continue more about this.
Assalamualaikum everyone. So now we already know what dual diagnosis is from what has been explained by Rahman just now. So for now, we will move into the significance problems in treating dual diagnosis patients. So what is the problem? Okay, so first of all, the problems in treating dual diagnosis patients is that the treatment process itself is a complicated process. This is because these two conditions need to be treated simultaneously. If only one condition been treated at one time, it will lead to the relapse of another condition. So it is a need to treat both conditions at one time. So, what else? What is the other problem? Okay, the other problem is that there is still lack of comprehensive and coordinated mental health guidelines in treating dual diagnosis patients. There is also still lack of facilities and also mental health support in treating dual diagnosis patients, as there is only about 1 or 2 mental institutions that only cater dual diagnosis patients in Malaysia. So it is a need to improve our mental health institutions to help these patients. So that's all for the significance problems in treating dual diagnosis patients. We will move into the next discussion by my friends.
Currently, integrated treatment is the best approach in treating dual diagnosis, where the same clinician will incorporate both treatment for mental illness and substance use disorder rather than treating them individually. It was proven to be effective and have good prognosis. The treatment also need to be customized and personalized because different patients will have different mental illness and also different substance use disorder. There are two strategies for treating dual diagnosis, which are non-pharmacological treatment and pharmacological treatment. The non-pharmacological treatment involves psychosocial and somatic therapy. Psychosocial therapy can be done through several methods such as motivational interviewing and family interventions. Moreover, in somatic therapy, it can be done through electroconvulsive therapy and biofeedback. The second strategy is pharmacological treatment, which involves the use of medications. The medications must address both conditions. Mental illness, mood stabilizers, antipsychotics, and antidepressants were used. Meanwhile, in substance use disorder treatment involve the medication that helps in managing craving and withdrawal syndrome. In brief, the non-pharmacological treatment need to be started first to help in controlling mild disorder symptom. But if the symptom does not resolve, medication should be added with adequate doses. The medication use should be initiated with the one that has low potential for abusement. Then, the potential interactions between the medication prescribed and also the adverse effects need to be highly monitored.
Assalamualaikum warahmatullahi wabarakatuh. I will further explain on proposed strategies to be implemented in Malaysia. In order to provide the best treatment of dual diagnosis, Malaysia should implement several strategies which are proven effective in other countries such as United Kingdom and United States. Firstly, Malaysia should provide a clear clinical practice guidelines that contain clinical guidance of dual diagnosis treatment. Secondly, Malaysia should integrate the community mental health center services and anti-drug agency in order to integrate both mental illness and substance abuse disorder treatment. Thirdly, both services should cooperate by providing their specialists to give advices and training to each other's services. Finally, the placement of patients should refer to the type of disorder which are more severe. That's all from me. Thank you. Further discussion will be explained by my friends.
As we know that dual diagnosis is the association between mental disorder and substance abuse disorder. Thus, the treatment of this particular disorder needs a cooperation between mental health service and addiction service. In addition, many of the healthcare professionals such as nurses, doctors, pharmacists, psychologists, and psychiatrists will work jointly as a team in treating dual diagnosis patients. Now, let us talk about the roles of pharmacists as healthcare provider in treating dual diagnosis. Firstly, pharmacists as a profession in the team is being practiced by many other countries such as UK, US, New Zealand, and Australia. Secondly, in dual diagnosis treatment, pharmacists got a few special roles such as need to be expert in high potential abuse drugs. For example, supervision of methadone as anti-addiction. In Malaysia, there is a part of a form needed to be filled in by pharmacists in regards to methadone use. Besides, in Glasgow, any pharmacist that is willing to be methadone supervisor is rewarded by the government. And lastly, pharmacists that are in Scotland and Glasgow anticipated in needle and syringe exchange service. However, there is a slight difference between those both of the countries, whereby the service is being offered with no charge in Glasgow instead of selling of those items in Scotland. All in all, it can be said that pharmacist roles are very crucial in managing dual diagnosis. Thank you.
وأنفقوا
وجاهدوا في سبيل الله ولا تلقوا بأيديكم إلى التهلكة وأحسنوا إن الله يحب المحسنين